lower back pain?
Sure do.
You do?
Yeah.
Oh, no, it's been a big one for me. So my name's Julia.
I'm Isabel.
And
we are
yoga therapists. So back pain comes from many different sources, but today we're going to talk to you about one of the main sources, which is SI joint pain. Okay, let's get started. So Isabel, you're the exercise physiologist. Could you explain to us the mechanics of the SI joint?
Sure, Julia. What I'm going to do is use Thomas Meyer's lovely book, Anatomy Trains. And if we have a look on page 144, we've got the whole superficial back line here. So that's the muscle that's running right from the base of the neck. But today we're particularly interested, and you can put your own hands on your pelvic bowl. This is the back of the body, and this is the hips or the pelvic bowl. And then right there, you'll find that there's the sacrum at the base of the vertebrae. So the sacrum is a bony plate, and there's a little joint between the sacrum and the hip, the iliac.
So you're saying then that the sacrum and the hip are joined together with the sacroiliac joint?
Yes.
Right, okay. So what's the problem? I don't see why you get a pain there in the first place.
Okay, so what we really want in this area is to have stability and mobility. What happens oftentimes for mums, for pregnant women, for yogis, for dancers, is that they will get hyper mobility in this joint. So there becomes like a shearing tension there. Also, what happens is, particularly in women, but men also come in with this pain, is that they have low pelvic floor tone. So the pelvic floor muscles, you know, if I say go jump on the trampoline, you'll be going, no way. That's how you know pelvic floor muscles are not working.
What if you're, say, a soccer player, or, you know, something where you're kicking something hard on one side? Could that affect the SI joint?
Absolutely. So the SI joint, or the sacrum and the ilium, they love to have stability. So you can see here this skeleton is nice and stable. As soon as you do one-sided things, that can put that instability in.
So these two muscles that are coming down from the spine, is it the same on the other side, but just not in the picture?
Absolutely, yes. So we are bilateral with our muscular system.
Awesome. All right. Thanks so much, Isabel.
No problems. Oh, morning, Julia. What are you up to?
Oh, I'm just having breakfast.
Ah, it's an interesting position to have breakfast in.
Okay. Well, I find really helps me with lower back pain. So you make sure that the thigh is rotated out, and I roll a calf, and I press down through the heel, and I make sure I've got that posterior tilt, and it really helps me.
Great. So that's really giving you a lot of space in your lower back, and it looks like your thigh bones are really squeezing in.
Yeah.
Nice.
But a lot of the exercise physiologists say that one's not so good. So it's funny sometimes, I know this works for me, but a lot of them say instead, like you were telling me before, that this one is better. So I just make sure I'm in the right spot. Yeah. So I'm really still working through that leg, and I'm pressing down through the foot, and I'm bringing this leg back. So I'm sucking that into the hip joint.
That looks even
better
than breakfast.
Yeah, looks better than breakfast. It's a bit hard to eat breakfast from here, though.
I might have to pass this to you.
And if I spill, I mean, I'm not cleaning the floor.
I know. That looks so good, because one of the main reasons for SI joint pain is too much sitting. So,
okay.
Awesome.
All right.
You bring on the pancakes.
Okay. There's one other thing I want to show you quickly while we're here.
Sure.
So you can do this, I mean, not just a kitchen bench. Some people don't like you having your foot on their bench. I don't know why. But I do this when I go for a walk, and I just find any kind of like a railing or a bench anywhere, really. So you just put your hands on the bench, and you stretch out, pull the lower belly in, bring your heels underneath your hips, feet are hip width apart, and then just pressing through the hands and bring the tailbone back, ears between the arms, and that's really powerful stuff.
Wow, that's so great because that's really working those legs. And hey Julie, just on our lounge floor we have a block.
Oh really? That's a bit handy, isn't it?
Yeah, that's pretty handy.
What do you reckon I should do with that?
I reckon just put that up as much. So let's really engage. Yeah, let's
Alright, so I'm
really
going to
engage.
squeeze the block.
Yeah, you're going to draw it right up.
Draw it right up.
Yeah.
Okay, and then try it again. So it's better when the bench is further away. We need to move that couch sometime. So so the hands are nice and flat, but anyway, so I'll draw it up, and then you can tell me if it looks any different. It certainly feels different.
And so how is that feeling different?
It's more contained. It's like I've got control.
Great, that looks like a beautiful line.
Stronger.
Looks like the kidney energy is really nice and relaxed, like a nice pool. Nice work.
Great, thank you.
Okay, let's get back to breakfast.
Okay, I'm hungry.
So Julie, just lie down on your back, have your feet on the blanket. We're going to stabilise the SI joint here. First of all, we need to find a neutral pelvis position. So I'm going to get you to flatten your back completely. Lovely. And then put a little arch in your back. And then come to somewhere in between where you feel comfortable.
That feels good.
Good, okay. Gently draw the belly button to the spine as if you were sewing a button on a teddy bear. Good. And then the last thing I'll get you to do is to find your bones of your hip bones and then come just inside. Turn your head away from me, please, and do a little cough and feel.
I'm not sick.
Yeah, so feel, I know you're not sick. Feel what's happening there. Could you feel that muscle?
Yeah, totally, especially when I laughed.
So, laughing or coughing will engage the transverse abdominis. We need to have this set in order to get out of that pain. Alright, let's go to the next level now. So I'm going to use a block. You can also use a ball. It's a little bit more comfy perhaps. I'll pop that between the thighs. Okay. Julia, you're going to squeeze that block very gently. Good. And then you're going to squeeze it a little harder, about 70%, and hold it for 3 seconds. Take a breath in to prepare, breathe out, and squeeze, 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 and then release. Okay. So she can repeat that about 8 times.
8 times? Okay.
Yeah. She's going to do that a couple more times while I bring in the next piece of equipment.
Take this one out.
Take that one out. We're going to pop the belt around the thighs. So I've set this belt up so that the legs are hip bone width apart and parallel. Then we're just going to clip the belt. Probably best not to use one of those TheraBands unless it's the tougher, the black one. Alright, we're going to just check that belt's there, good. And then you're going to push the legs apart. Okay. Push for 3.
So inhale?
Yeah. 2, 1, and relax.
And I keep all that other things pulled on still
absolutely.
At the same time?
If
so
we don't have
everything.
stability, if we're like a jellyfish, then boom, when there's that proverbial banana skin on the ground, that's when everything's gonna hit the fan.
Okay.
And it's not pretty. Not pretty, and when you've got SI joint pain, doesn't matter.
It's not fun.
No, you can be a cranky. Alright, so we've had the pushing in with the block, we then had the pressing out. That may have given you a little adjustment in the pubic symphysis, so you may have felt a little click. Doesn't matter if you don't. Both of those you can do about 8 repetitions. Last one I'm going to show you today, Julie's conveniently got her feet on the blanket. She's going to press a little bit more through the big toe base. Keep the legs that distance apart. Raise the buttocks up, please. So level 1 is just raising the buttocks up and then bringing them back down. Nice. Good. Okay. Level 2, we're going to raise the buttocks up and then see if you can slide that blanket away. Good. Come back down with the buttocks and bring the feet back in. Okay. Great. Level 3, for those of you who really love a challenge, let's lift the buttocks up. Take the blanket away. Nice. And then bring that blanket on in.
Is it okay if I screw up my face at the same time?
That's awesome. And that's a wrap for today. So we've got 3 exercises: squeezing the block or squeezing a ball. we're using the belt around the thighs, pressing out, and that challenge. Let me know how you get on with this, and let us know how your pain goes. Namaste.
Feels really good. So all you need for our yoga therapy is a blanket, a belt, a firm block, not one of those rubbery ones, and a good sticky mat. So that one's made of rubber. It's really nice and sticky. And we've got another mat underneath just because the floor is really hard. Okay, Isabel, time to wake up.
Oh, I'm in pain, Julia. Have you got something you can do?
Yeah, totally. So this is one that really helps me a lot. And depending on the level of your pain and your flexibility, there's like 3 different levels. So the block has 3 levels, so 1, 2, and 3. So we'll start at this one first, and you want to put the block where the sacrum is. So the sacrum is like that triangular shaped bone that's at the bottom of the tailbone. So it's not on your back, it's not on your bottom, it's on this bone here between the hips. Okay, so let's just have our arms flat on the floor by your sides. I usually do palms facing down, and then just pressing up just a bit, and then we'll put the block underneath the sacrum. So all you do is you just relax here. So it's a very passive kind of an exercise, and it's really about helping the body to come into its own natural alignment. So you stay here for a while, and then depending on your condition, then you can go up to the next level. So I'll just get you to
wow, that's immediately relaxing.
It is, isn't it? It seems so basic. Is that a good spot?
Oh, that's great.
Great. So so now I see that you've rolled your shoulders under, so that's great. So you're getting some lengthening through the neck at the same time. It's the same thing here. So I'm just noticing that foot should be in a bit because you're a little bit, your knees are kind of going this way. So make sure that you have a look and that you have a line going all the way down to your knees to the feet. Excellent. Alrighty, so let's press through the feet and we'll do the last one. Actually, you might need to do that. So just use your hands.
So I'm going to go up on my
press
tiptoes.
up on your tiptoes.
Yeah,
So
I'm
that's it.
not
And you've got to
tall
go
as you.
sideways. Yeah, for me, I don't have to come up so high. Alright, and then you can interlace your fingers around the block as well. And then just roll the shoulders right around here. Perfect. And lengthen the neck. Flatten feet. Good. Let's have a look at those. Great. Yeah, looking good, looking good. So again, so it all depends on where you're at. So I usually stay here for like a few minutes, and it's very, very powerful. So when I get lower back pain, this is usually the first thing I do. I just stay here passively, and that usually, for me, fixes things up these days because I've done a lot of work on this. Anyway.
Oh, level 2 feels like the sweet spot for me. Thanks,
Okay,
Julia.
You're welcome.
Yeah.
Okay, see you later.
Okay.
So this little film was shot on location at Cabarita Beach Yoga. Isabel Gordon runs this yoga school. This little video clip was taken by Julia Sawyer, the Rosa Yogi. So our contact details are going to be in the information down below. It'd be lovely if you'd like to subscribe to my YouTube channel, and any comments or suggestions or anything that you would like us to focus on, please let us know so we can make a video for you. I'm sure lots of other people have the same kinds of questions. So it's going to be every Tuesday, Yoga Therapy Tuesdays. Okay, have a wonderful day. Bye.